All right. So my name is Luka Nikcevic, and I'll talk today, discuss topic about children immunization, and more particular, if should governments implement punishments for parents whose children are not vaccinated according to the recommendations. Um, so, little overview of what we're gonna go into. Is I'll briefly introduce the topic, history, topic question and opposing sides. I'll declare my own position on this topic, provide some definitions and explanations about key terms for better understanding of the topic, some historical context that is relevant to the topic. Then I'll provide arguments for both sides and then supporting evidence from scholarly articles for these arguments. And finally, I would critique and evaluate this presentation in a way of what would happen if either of the sides prevails or what I think should happen. So throughout recent history, there have been occurrences where public safety has been threatened by re-emerging diseases, and children have been suffering from preventable diseases because of the lack of vaccination compliances. Um, this is occurring worldwide and is one of the major concerns of public health nowadays. So, question that emerges from that is: should governments implement punishments for parents whose children have not been vaccinated according to the recommendations? There is obviously two views to this point. Is one of them is that government should implement punishment for these people, and another one is that they should not. Um, so my position on this particular topic is that government should implement punishments for parents who do not follow vaccination recommendations for their children. This is to ensure the well-being of these children and public safety as well. Simply because immunizations represent an effective and simple way of protecting humans from certain diseases that can be a serious threat to their health otherwise and health of the public as well. Therefore, if regulated in a safe manner, uh, these vaccines should be mandated. So some of the definitions that might be helpful is what is disease? Disease is loss of health or loss of normal body function. Immunity is bodily protection against an infectious disease, um, virus, bacteria, fungi, and etc. Vaccine is a product that stimulates a person's immune system to build immunity to a specific disease or infectious agent. Immunization is defined by the World Health Organization as a process whereby a person is made immune or resistant to an infectious disease, typically by the administration of the vaccine. So what are preventable diseases? Those are diseases that can be prevented or even eradicated by successful implementation of vaccination programs. Herd immunity is another important term, which indicates the mass protection from infectious agents caused by vaccination of most people. What that means is that if, let's say, 90% of people is vaccinated against particular disease, then other 10% who are not able to be vaccinated or not vaccinated for whatever reason are also protected by that by default, right? Then anti-vaxxers is a group of people or individuals that may take a stance against immunizations and see vaccines as necessary or even harmful. So, with that being said, a lot of historical context. It's not as linear and has like cause and effect as some of the other topics, I'm sure, but it's important to mention, I think, that let's say for um, most of the today's, let's say, recent debates and discussions or anti-vaccine movements were coming from this article in the Lancet paper from 1998 that declared that 8 out of 12 families whose kids received an MMR, which is measles, mumps, and rubella vaccine at a hospital in North London, claimed their children developed first signs of autism within 2 weeks. So this is followed with podcasts or like even television presentation of Dr. Under Wakefield, who claimed that MMR vaccine is too concentrated and that therefore causes um, these undesirable effects on children. And he suggested that these vaccines should be divided in three separate ones. However, public reacted turbulently to this news, this information, and many of the people decided not to vaccinate their children with MMR vaccine, which in turn caused outbreak of measles and even some deaths in children from this disease. So as a response to all this, medical field, medical scientists try to like research these claims about MMR vaccines and managed to disprove or not find any relationship between MMR vaccine and autism. However, this took 12 years, and many of the today's or more recent anti-vaccination movement were based on this information in particular. Then the second one, um, like the event that like I think it's um, or is significant in representation of vaccine importance is polio outbreak in Somalia reported in May uh, 2013. This outbreak prompted many of the vaccination program to get in motion and actually like go into Somalia and try to vaccinate as many people as possible. And the results of these programs were significant because within 1 year, the number of polio cases decreased from 194 to 5 cases, and that's only 1 year with these movements. So the third one that I think it's important is um, resistance. So that Catholic bishops in Kenya called for boycott of polio vaccines in 2015. This is prompted by Dr. Wahome Nagare, um, who is doctor of Catholic Association of Doctors in Kenya. He is a gynecologist who claimed the possibility of existence of estrogen derivative in these vaccines that would cause sterility in male children. Also, like, he was questioning if vaccines can introduce some cancerogenic agents, HIV, or even cause autism. However, his stance was pretty clear that his mistrust is not in idea or concept of vaccines that he actually supports, but in World Health Organizations or Western organizations, so to speak, they're bringing these products to Kenya. So there is a lot of mistrust uh, to some of the public programs, so to say. Um, so obviously, like there are two sides on this topic. Those are people who think that parents of children who are not vaccinated against diseases according to recommendations should be punished, and those who think they should not be punished. Some of the arguments for those who think that they should be punished would be control of preventable diseases, overall well-being of children, and developing herd immunity for, um, let's say, public protection. Then for those who think that these parents should not be punished, I'm more concerned about demographic isolation and poor accessibility of medical services to some people. Then lack of knowledge regarding vaccination in some people is probably hardly their own fault. And some even research show that enforcement might lead to further resistance to immunization and opposition to governments. So supporting evidence for those who are in favor of these punishments. Um, well, according to Corrupt and his associates, immunization is one of the most efficient and cost-effective healthcare intervention for preventing disease and guarding community from diseases that can be avoided. In addition to this, also Garagna states that vaccines can currently prevent more than 26 diseases. An estimated 1.5 million children still die of vaccine preventable diseases each year, and many millions of individuals of all ages suffer significant morbidity. Achieving and maintaining high vaccination coverage in diverse settings is an important public health priority. Well, Gravagna added to this with another announcement or statement stating that the increasing proportion of vaccine hesitant individuals who refuse or delay vaccination for themselves and their children create challenges for communities and countries aiming to prevent or reduce the burden of vaccine preventable diseases. Also, as a reason why the majority of health workers are in favor of childhood vaccination, um, as people who are probably most likely educated on healthcare issues, Musa indicates that vaccination protects children, the vaccinated children, as well as the ones who are protected through herd immunity or those who cannot be vaccinated, and it prevents an outbreak of disease and has even eradicated some diseases in the past. So, supporting evidence for those who are against punishments for parents who choose not to vaccinate their children according to recommendations. According to Koshon, I'm pretty sure I'm not doing justice to these people by pronouncing their names, but the reasons for lower vaccination rates in Appalachia and rural areas of the United States are varied and might include socioeconomic status of the area, geographical isolation, fewer medical providers, and a physical environment that might make it difficult to adhere to vaccination schedules. Then he continues in saying that parents do not vaccinate their adolescent children for several reasons, including religious belief, poor knowledge about the vaccine, and concerns about the vaccine. So these we conclude that these are linked. If they have poor knowledge and maybe are prompted by some of the, let's say, public beliefs, other concerns for their children, they might choose not to vaccinate them. Then Gravagna adds that after Serbia implemented stricter mandates following a measles outbreak without significant improvements in communication, the public response was increased anti-vaccination support, negative media coverage, and low confidence in the program. So I guess these movements can even backfire if they're not implemented correctly. So what can we get, like, what would happen, what is likely to happen if either side prevails? So implementing punishments for parents who are not compliant with the vaccination recommendations regarding their children might result in the increase of vaccinated children, herd immunity, decrease in illnesses, or eradication of certain diseases, and overall well-being of children. However, it might also result in unfair treatment of parents who live in isolated areas, do not have sufficient education on the topic, and or do not have resources to follow the immunization recommendations. And then on the other hand, not implementing punishments for parents whose children have not been vaccinated according to the recommendations will offer parents freedom of choice and possibility to reduce skepticism in government control. But vaccination coverages will be susceptible to popular opinion, therefore probably oscillate more frequently. Outbreaks of diseases will be more frequent, and morbidity and mortality rates will increase. So, in the light of supporting evidence or lack of thereof, it is hard to predict what will actually happen due to a variety of cultural and governing attitudes toward immunizations. However, idealistically, certain vaccines should not be subject to parental decisions because the interest of majority should preside over personal preferences and convictions. Therefore, all children who are medically eligible should be immunized against preventable illnesses with no exception, and parents who decide to be in the way of this should be subject to consequences. Moreover, in order for parents to be held accountable, availability and accessibility of medical services for their children will have to be established, as well as adequate education on the reasons for specific immunization practices, benefits, and risks.
Honestly, you hit it out of the park. That was really well done. Really good information, really well cited, well organized. Um, I really like the way that you the thing that is a real benefit is that you not only just like dropped a quote and then just said, hey, here's the evidence, like you actually gave context to it, and you uh, provided context as you were coming along, so you weren't just completely reliant on slides. So I really really want to commend you on that. That was really quite good. That was excellent. I don't really have a lot of notes. It was really good work. Commit that, write the final. That's no, it was good. You did a really good job.
I appreciate it.